reading comprehension issue versus test taking versus content gap. And so for content gap, if you ask every single student across the entire nation, can you explain a topic to me, and then miss a question on it, I would say that's probably universal. So that's very hard for me to go off of, because nobody obviously feels like they study something and then they can't explain it at all, right? So let's try and really nail it down. So let's go off of your actual metrics. Can you pull up in your UWorld right now?
Oh, I am not on my computer. Maybe I can show you next time if that's okay with you.
The thing that I need to see from there is gonna be whether you change your answers from correct to incorrect, incorrect to correct, or incorrect to incorrect. So that's step number one. That would be helpful to know, because if you're changing your answers and they're not the majority of the time, over 65 to 75% of the time, changing from incorrect to correct, then that's something that we need to address with your actual algorithm of how you're thinking through whether you should change an answer or not. If your numbers are off for that, then let me share something here that is helpful. By the way, have you went through the test taking strategy section on School yet?
Not yet. I think maybe I should do that this week or something.
I would definitely recommend it. It's many students' favorite part of the entire platform. So if you go to the classroom and then go to the boards, and then I'll share my screen here. So it's within this section. So classroom, the boards, and then test taking strategies. There's all kinds of stuff in here to check out. I think it'll be very, very helpful from what you've told me so far. But let's dive even further. So we've talked about analyzing your UWorld percentages of what you're changing. And I'm going to make a little mental note for you here. So if you are changing your answers from correct, incorrect, or incorrect to incorrect greater than 35% of the time, so I'm saying 35, which is the inverse of 65, how we talked about it a second ago, then you need to reanalyze your criteria for changing answers, okay? And I discussed my exact protocol for that in the very first section of the test taking process. And so it'll basically break down the algorithm of whenever you're stuck between two answer choices, should you change your answer, yes or no? Okay, so there's a lot of data that we can pull from this. I would definitely go through that section. It'll take you maybe 15 minutes to read. And there'll be like literally a 4-step process that I want you to put onto a sticky note. It'll be the next thing for you. Please write the 4-step process onto a sticky note and refer to it each time you feel like changing your answer on the exam. Okay. And so oftentimes this is the easiest fix. Like, are you changing your answers inappropriately? If so, then that's something that we can fix literally in one day. Okay, so you follow the algorithm, you put that on the sticky note, and now you force yourself to follow that each time that you find yourself in that predicament. Does that make sense so far? So that's step number one here. Step number two is to assume that you have a content gap, basically always, okay? And the reason that this is helpful, and obviously there's going to be other things in addition to that, but assume that you do not know 100% of the information. And the reason I say that is because that will open your mind. The next thing is going to be to assume that you have a content gap, okay? And so this will open your eyes to realizing that you don't know all of the information. And I put yet in italics because you're going to know the information, but it's a developing and growing process. And so a lot of the times what I see with students is that when you attribute your performance to a test taking issue, even if there is an element of test taking, that almost closes off your mind to the process of, okay, my content is not there either. And so now you just keep attributing, oh, I missed that because of test taking. I missed that because of test taking. And it becomes a self-propagating cycle, which doesn't allow you to continue growing as fast as you would otherwise. So assuming that you do have a content gap, I think is helpful just from a mindset and mentality perspective, okay? The next thing is, are you running out of time at all? So that's going to be step number 3, is assess if you run out of time on certain standardized exams. And so we'll say shelf versus USMLE. Step 1, step 2. Is that ever an issue for you at all?
No, except for this rotation. It's never been an issue until this rotation. Yeah.
Okay, so for this rotation, what's different?
I think because it's IM, it's a lot of stuff.
Okay, so that actually solidifies number 2 for me. If you feel you are running out of time in a specific subject, it's because you don't know that subject as well as the others. And so it's really funny that you mentioned that, because that actually fits perfectly into the algorithm here. On the test taking section within our platform, one of the very first things that I say is, why do you run out of time? And then the line below that is literally, you run out of time because you don't know the material well enough. Because think about an exam that you overstudied for. Because of course, there's going to be an exam in your life where you've walked in there, you've been super confident. You were probably one of the first 20% of the class done on that exam. Maybe you took your time to check your answers and all that kind of stuff, but you weren't like cutting down to the very last wire on a test that you over prepared for, because you can move more swiftly when you move with confidence. And so competence breeds confidence. And so step 2, there's a couple commonalities here is, yes, we need to analyze your test taking. You're following the correct steps of actually reading the question and analyzing it and going through your answer choices. Now we need to assess the changing your answers, and then we need to assess the content. The thing that you said about what you highlight, I think is really important, is the pertinent positives. A lot of people tend to over highlight. Okay, so let's talk about that real quick. Many students tend to over highlight, and that does 2 things. Okay, so this will slow you down. This can cause you to focus on things that are irrelevant, or can cause you to miss important details when you reread the question. Because if you highlight too much, when you go back and you read the question and you're analyzing it, if like every sentence has like one thing highlighted in it, you're going to just automatically subconsciously skip whatever the rest of the sentence has in store. And so you can actually end up almost screwing yourself in that way, excuse my language, because you almost fine tune your eyes to disregard the other aspects. So definitely, I think the highlighting can be something that can throw you off too if you're not careful. So I want you to be hyper cognizant of this. And so this is kind of my rule of thumb. So rule of thumb: if the paragraph is relatively small, I don't even highlight. I only highlight on huge blocks of text for abnormal findings, so I don't lose my place when reading or thinking. Only 40 to 50% of test questions require highlighting. So try to keep this in mind. So if it's like 4-sentence question, you don't really need to highlight anything there, because the time it takes you to move your cursor, to highlight, to then keep reading, figure out where you're at, because now you kind of like jump tasks and almost thrown yourself like a little bit behind. Like maybe if you just lose 5 seconds per question doing that, that adds up. Maybe it's 5 to 10 seconds, you know? If it's like a small question with 4 sentences or so or less, I wouldn't highlight. If it's a big block and you have tons of labs and different things to look through, imaging findings, etc., and of course, you want to highlight so that you don't actually get lost in the sauce. But I find that a lot of students just overdo it with the highlighting. So when you're doing your next block of questions, look at this step number 5 here and actually assess. Go through it after you've actually taken the whole block, and then read through and be like, how did my highlighting go? Was I overdoing it? Was I underdoing it? Was I missing certain things? And so this actually incorporates an element of self-analysis. So after your next block questions, go back through and analyze if you over or under highlighted using these rules above. Okay, so this is kind of a little bit of self-accountability here, because it's almost easy to highlight as you go because it's very passive, and it's like, well, it makes you feel like you're progressing through the question if you do it. So try not to. Try only doing it when you actually need it on a question. Does that? Number 6 is to actually think about what the question is asking literally. Okay, and so that sounds very, very obvious. Obviously, if you're doing a question, you want to think about what it's asking, but think about it even beyond that. And so I'm going to put in parentheses here, from a patient perspective. Okay, so if the question, I'm going to say for part number 1 of this is think about the setting. So if the question is in or a more acute care setting, they are likely looking for a different answer than someone in a family medicine clinic, or I'll say outpatient clinic, right? Just think about generally what they're asking from a setting perspective, and then think about it. So that's part number 1 of step 6. Then I want you to think of it of a least invasive to most invasive. Okay. And so correct answer is 99% of the time the least invasive but next best step. And so, for example, if a patient shows up to the ER and they have a red foot. The next step is probably not to do an angiogram. The next step is probably to get some labs, to get a foot x-ray, maybe an MRI if the x-ray shows any kind of possible signs of osteomyelitis. Like, they're not going to ask you to go to the catheterization of their tibial arteries as the next best step. You know what I mean? Like, they're going to go least to most invasive. So this is a quite literal thing. This is something that if you're in real life, that it'd be a no-brainer. You're not going to jump to chopping somebody's toe off before you do something very minimally invasive, right? So really put yourself in the setting and in the situation quite literally. So put on your doctor shoes, essentially. And you got a lot of knowledge. And so that knowledge, you want to make sure that you're actually applying it appropriately. And that's what gets to be really tough, is because on these shelf exams, you're almost, what's the word? You're almost like shifted into thinking in a certain way. And then it gets to be difficult for step 2, because now you're not just doing only family medicine questions or only inpatient questions or only surgical questions. Now it's obviously all of them. So you have to actually be very cognizant of it. The questions don't get harder in that regard, but you just have to be more cognizant of it. Step number 7 that I want you to try. All right. So if you don't know the answer immediately, this is what I want you to think about. So part number 1 of this is rule out the other answers. You can't specifically rule in the correct one. Okay. So there's going to be, of course, 1 or 2 that you can for sure say, no, this is definitely not even the right system. This is not the right diagnosis. Boom. We can cross those off. And I want you to actually cross these off if and only if you're 100% confident that they're wrong. Okay. If you're like 80% sure, I don't want you to cross it off. But if you're 100% confident, cross it off. So this will decrease your cognitive load so that you can better focus on the remaining choices. All right. If you know that one of the facts in the question stem supports an answer to be true, and the other aspects of the question stem you are unsure about, pick the answer choice that you are at least partially sure about. Okay. And so that sounds really obvious when I say it out loud like that, but think about it like this. You're reading a question and you see the answer choice A. You're like, okay, I understand that this answer choice should have a leukocytosis and the patient has a leukocytosis, but I'm not sure about the rest. Okay. File that aside for a second. Then you look at answer choice B, which is the only answer choice left because you've crossed off C through E. Answer choice B is kind of a zebra, but you're not really sure if they would have leukocytosis, and you don't really know if anything else in the question stem supports answer choice B. I would tell you to pick answer choice A because you at least know that you're 100% certain that some part of the question supports that answer choice. And so this is basically to be careful about picking zebras that you are not certain any aspect of the question supports their answer choice. If you're down 2 answer choices and you still don't know, pick the more common answer choice. All right. This is not something that I want you to automatically go to, but I'm saying if you've done everything else that we've talked about, this is something that you can consider. And the reason being is more commonly seen diagnoses / treatments / managements are more tested. Right? Like, they're not going to have 15 questions on Proteus disease, right? Like they might have 15 questions on your boards about coronary artery disease though, because it's very common. Okay. So if you're stuck between 2 answer choices and you can't use any clues to really rule in or rule out one or the other, go with the more common answer choice, the more common disease. So don't fall for picking something that you've never seen just because it's an answer choice. And that's one thing that can be difficult because obviously the question banks, they try to include some questions on these zebras, but on your actual test, there's not going to be a lot of answers that are zebra answers. So on your shelf exams, on your step 2, on your step 1, they're not trying to see if you know this like 1 in 100 million disorder. Like, they're really not. They want to know if you can definitively pick the common diagnosis and treat it appropriately. If you do that, you should be able to pass the test. You don't have to know every single zebra in the game that doesn't show up in your first aid and your practice questions and your Q banks and your videos and your notes. If it's not shown up in all of that, it's probably not the correct answer, like 99% of the time. Like, it's not like the more years that go on for the USMLE, it's not like they're testing more and more and more diseases that are just like super oddball things. The question banks do, but the actual USMLE itself and the shelf exam, they're not going to do that. And so that's one reason why I actually really like the CMS forms. I'm not sure if you've been through them quite yet for your internal medicine rotation, but the CMS forms are super valuable because they basically delineate what are the more common diseases and disorders to focus on. And so if a disease or disorder is within the CMS forms, 1,000,000,000% you should not sit for your exam if you don't know all of those topics, because they are just incredibly high yield. They're the very bare bones of what you need to know for your shelf exam. And obviously they can test you on things outside of that, but those are the things that you 100,000% have to know. Okay. So I'm going to give you a caveat here for shelf exams. If a disease is on the CMS forms, you must know that disease well. Sit for the exam. Let me just, that is kind of its own point here, because I think that's important to keep in mind, because it's very easy for the super broad shelves like surgery or internal medicine to get lost in the sauce of the 50 million things that it feels like you need to know. So narrow your focus. Make sure you know the bare minimum first before you start focusing in on the zebras. Okay, step number 4 of what to do if you don't know the answer choice immediately. So what I like to do here is, if I don't know, I will move on quickly and then try to save time to get the rest correct. You can always come back. All right. So if you don't know, don't burn the rest of your block by focusing in on it, especially for the biostat stuff and the ethics stuff. I see that very, very commonly every year, where people get hung up on it on question 15. And then for questions 30 through 40, they're rushing because they spend so much time on question 15. So if you don't know it and you're not feeling like you're making any progress and moving forward, and it's just causing a mental mind blank for you, click and move. Obviously, don't leave it blank in case you don't get time to come back. Pick an answer choice that you have not crossed out, move, and then come back to it whenever you're going through your flagged answers at the end. The next thing, the most important clue in these questions that are tricky are the objective data. So there's going to be a lot of things that are like, patient's abdomen is hurt for maybe 2 days. First it was in the left lower quadrant, then it was the right lower quadrant, now it's epigastric. They're going to give you kind of some subjective data like that. The objective data is how I get the majority of questions correct. Okay, so you want to know stuff like age, gender, laboratory findings, imaging findings, pathology findings. That kind of stuff cannot be fake. It cannot be generic. It's literally yes or no type of stuff. And so what I want you to do, once you go through all the objective data, so once you review all the objective data, put the whole picture together. Okay, so think of a patient that fulfills all of these data points, rather than thinking of everything as discrete, separate information. Okay. And so the reason I say that is because it's very difficult sometimes to synthesize when they have like 5 different things going on, but the boards will not give you 2 disease processes that are unrelated that are ongoing. Okay, so let me write that down for you as a reminder. The boards will not give you 2 discrete and totally unrelated processes simultaneously in the same question, throw you off. They're not going to give you gout-induced optic neuritis. Like, that's not a thing. And they're not going to try to make you make that huge jump. They want you to be like, okay, this patient does have gout. Yes, totally unrelated. Don't care. The loss of vision, what is the workup of monocular loss of vision? And so think about it in that way, because the biggest thing that emergency medicine doctors need to know is to be able to prioritize what essentially is the chief complaint versus what is kind of an unrelated issue that the patient came in with. And just to like further hammer that home, I got consulted on a patient this week who had dry gangrene of her toe. And they said, oh, she needs revascularization. She's probably got some arterial stenosis. Okay, I go to see the patient. The patient's in the neuro ICU, completely comatose, essentially, from a stroke. The patient was basically obtunded and non-responsive to anything. And so from my standpoint, I'm getting this consult from over the phone that says, hey, she has dry gangrene. We need you to do an angiogram on her. But then at the end of the day, when I go see her, that's not the case at all. Like, obviously, you can't do an angiogram on somebody that had a recent stroke, because then when you give them heparin, it's going to cause them to have bleeding of the ischemic penumbra in their brain. And so your job is to emulate what an emergency medicine doctor would be thinking in these scenarios, because a lot of these are E-type questions and it's all triage. Okay, so Comes in with dry gangrene. Is that emergency? Yes or no? No. Patient has a stroke. Is that an emergency? Yes or no? Yes. Okay, so go with what's the most life-threatening, go with what's the actual cause behind the diagnosis, and move onwards from there with your workup. Okay, so the next best step for that patient would not be a foot x-ray. The next best step would be a CT of the head. So that's what you really want to be careful about, getting lost in the sauce with it, because when you get to these questions, it's very, very easy to kind of get that cloudy mental picture and then just feel overwhelmed, when in reality, you might actually know that information. And if you saw it separately, you'd be fine. But then you get inside your own head with these type of questions. And Kyle mentioned a good point here, the ABCs. Like, that's a very, very good mnemonic to never screw that type of thing up. Because if somebody's airway is compromised, then you can basically disregard what's going on in the rest of the question, because that's A for airway, B for breathing, C for circulation. You know, like, those things will always be able to get you questions on your boards, whether it's step 1, step 2, shelf exams, because it's just order of prioritization. And so the boards really, really want you to be able to prioritize what's the most important, what's the most urgent. So I want you to think in terms of urgency, importance, severity of disease processes. Chronic conditions can likely wait while the chief complaint is being addressed immediately. And the thing that's tough is, in real life, like, the patient might come in with a chief complaint of something that's not actually what should be their chief complaint, but on the boards, they'll be very clear about that.